So we're going to look at the knee joint today, and this is primarily classified as a synovial hinge joint, which is specialized, providing a large range of flexion and extension movements. The structure of the knee is complex, involving multiple joints that work together to facilitate the wider variety of movements required for daily activities and physical exercise. This presentation will give an expansion on the different components of the knee joint, including the tibiofemoral joint, the patellofemoral joint, and the proximal tibiofibular joint. First of all, let's talk about the type of joint that the knee is. So it's a synovial hinge joint. It's sometimes called a modified hinge joint because it can do flexion and extension, but also medial and lateral rotation where the knee is at 90 degrees. Now, a synovial joint is characterized by the presence of fluid-filled cavities, so a synovial cavity, that provides lubrication, reducing friction between the bones during movement. So the knee joint is a type of synovial hinge joint, meaning that it can primarily allow movement along one plane, so flexion and extension. However, due to its complex anatomy, it also allows a small degree of rotational movements, and this is what happens when the knee is at 90 degrees flexion. Let's start and look at the tibiofemoral joint. So this is the largest and most significant component of the knee joint. It is formed by the articulation of the femur, which is the thigh bone. So the femur's lower end consists of two rounded projections called condyles, medial and lateral, which articulate with the tibia. Now the tibia, the shin bone, is the primary weight-bearing bone of the lower leg and has two plateaus, so medial and lateral, that receive the femoral condyles. Now the tibiofemoral joint is primarily responsible for the hinge-like movements of the knee, so flexion and extension. Again, this joint also allows a small amount of rotation, particularly when the knee is flexed, which is important for dynamic movements, such as pivoting in sport. The tibiofemoral joint has several stabilizing structures, including the medial and lateral menisci, the cruciate ligaments, so the anterior and posterior, and the collateral ligaments, so the medial and lateral. And then we have the patellofemoral joint. This is formed by the articulation between the patella, the kneecap, which is a triangle sigmoid or sesamoid bone that lies within the quadricep tendon, and then the femur, specifically the femoral grooves, where the patella glides up and down during knee movements. The patellofemoral joint plays a really important role in improving the mechanical efficiency of the quadricep muscle, which is responsible for extending the knee. By increasing the lever arm of the quadricep tendon, the patella enhances the forces that can be exerted during knee extension, particularly during actions such as kicking or jumping. The patella tendon attaches the patella to the tibia, further enhancing the efficiency of knee extension. Now, this joint is stabilized by various structures, including the quadricep tendon, the patella tendon, which are bands of connective tissue that keep the patella aligned during movement. Proper alignment of the patella is really important, as misalignment can lead to patellofemoral pain syndrome, a common source of knee pain, especially in athletes. Now, the proximal tibiofibular joint is less involved in the movement of the knee itself, but plays an important role in the overall stability and function of the lower leg. It is formed by the articulation between the tibia at its lateral edge and the fibula, so the thinner bone of the lower leg. This joint is located at the top of the fibula, near where it meets the tibia, and is considered to be a plane type synovial joint. Although the fibula is not a weight-bearing bone, the proximal tibiofibular joint plays a role in dissipating forces transmitted through the leg, providing lateral stability to the knee. It also assists in maintaining the integrity of the ankle joint by ensuring that the forces transmitted during weight bearing are distributed appropriately through the fibula. Now, the movement in the proximal tibiofibular joint is only slight, consisting primarily of slight gliding motions. However, any dysfunction in this joint can affect the knee's overall mechanics and lead to discomfort or pain during activities such as walking or running. What is the functional importance of each joint? So the tibiofemoral joint allows flexion and extension, essential for walking, running, squatting, and most lower limb movements. It also contributes to the minor rotation of the leg, which is really important for complex movements like changing direction. The patellofemoral joint enhances the efficiency of knee extension by providing leverage to the quads. It also helps protect the knee joint during activities that involve high impact forces such as jumping. The proximal tibiofibular joint contributes to the overall stability of the knee and lower leg by transmitting forces and stabilizing the lateral side of the knee. It plays an indirect role in knee function, particularly during weight-bearing activities. Now, the knee joint's function and complexity comes from the integration of multiple subjoints. So the tibiofemoral, the patellofemoral, and the proximal tibiofibular joint, each playing a unique role in stability, movement, and force distribution. This combination of hinge mechanics, rotational ability, and support makes the knee joint uniquely adaptive for a wide range of physical activities, from simple daily movements to intense athletic performance. Understanding these different components is vital for effectively managing knee health, addressing injuries, and optimizing rehabilitation protocols.